Hey everybody, I'm Augie Rodriguez. I am the BQAC president, and today's really special. In case you missed out on our actual Zoom event, we wanted to provide this resource to you on YouTube. As many of you know, trans folks have been around since the beginning of history, way before Marsha P. Johnson and Sylvia Rivera were the spearheads of the gay revolution at Stonewall back in the 60s. One of the issues that many trans folks and non-binary folks have are trying to get gender affirming care with either top or bottom surgery. And one of the resources that they need is a letter of support. Here in the Chicagoland area specifically, we have a letter of support resource through the Center on Halsted. And with me today to discuss that is our lovely trans sister, Eve K, and Dr. Ashley Molin, who's part of Center on Halsted's Behavioral Health Department. So I just want you to go around the room and introduce yourselves.
Hello, my name is Eve. My pronouns are she, her, hers, herself. I am a board member of BQAC, and I mainly lead book clubs here at BQAC, though I do some discussion group stuff sometimes. And so yeah, Augie basically explained it already. So that's basically like yeah, so I'm trans and I'm bi. Okay, so I'm gonna pass the baton over to Dr. Ashley Molin.
Hi, all. I'm Dr. Ashley Molin. I use she, her pronouns. I am the Associate Director of Behavioral Health at Center on Halsted. And one of the services that we offer in the behavioral health program is the writing letters of support for people who are seeking gender affirming surgeries. So I'm here to tell you a bit more about that.
Awesome. Eve, and would you like to start off the conversation with one of the questions?
Yeah, so I think I'd like to start by asking about the history of this of the letter writing project. And yeah, I guess we'll start with that.
Yeah, so there's an organization called WPATH, which is the World Professional Association for Transgender Healthcare, and they set standards for how medical providers should navigate assisting people with gender affirming care. One of the requirements that they have, if you're interested in accessing surgery, is that you need to get a letter from a mental health professional supporting that. Uh, Probably about 8 or so years ago, when my boss started at Center on Halsted, he spearheaded beginning this letter writing program because getting a letter previously could be a very big barrier for people. There are lots of therapists that would charge a lot of money, require that you be in multiple therapy sessions. And so we really wanted to start a program that made the barriers as minimal as possible. So people can come to us to have one appointment. We'll bill your insurance if you have insurance, but if you don't have insurance, we don't charge for the letter. We'll meet with you for this one appointment, and at the end, we will write you a letter that you can take to whatever surgeon you need in order to access the services you're looking for. So, really trying to make this letter writing process as easy as possible. Ultimately, we think that people shouldn't need letters to access the surgeries and the care that they want. But so long as that's the system that we're operating under, we want to make it as easy as possible for people.
Yeah, so I remembered thinking to myself because in Illinois we have appropriate clinical care appropriate clinical treatment standard as our the main driver for say legal transition. And I remember basically asking um basically I remember you mentioning that a lot of the people that come also come from Wisconsin and Indiana and Missouri, and that we had looked up basically the legal requirements in those states via the Identity Document Center on National Center for Trans Equality's website. Um, I guess what I'd like to ask is what are the experiences what are some general experiences working with people in those areas. And also I remember you bringing up that people need to be within the borders of Illinois in order at the time of the appointment. So if you could elaborate on that and also who else is able to like basically come to the project, that would be great.
Yeah, so the way licensure works currently is you get licensed in a state, and then you can see people who are located in that state. So, for example, all of us at Center were licensed in the state of Illinois, and so we can see people in the state of Illinois at the time of the appointment. Which means if you're located just over the border in Indiana or Wisconsin, maybe even in Missouri, you could come into Center proper and like see us in person if you wanted to, or just be located in the state of Illinois during your appointment. If that's not accessible, right, because not everybody lives really close to the border, there is also a really great website called the Gallup. It's the Gender Affirming Letter Access Project that maintains a directory of clinicians who are willing to provide uh, surgery letters at no cost. The website's been sort of finicky recently. They're working on getting it back up and running, but once it is, hopefully soon, whatever state you're located in, whether it's New York or Texas or California or Utah, you should be able to go on there, look it up, and find a clinician who could provide a letter at no cost, right? So there's a whole bunch of clinicians across the country who are really wanting to support people as best we can in the system that creates a lot more barriers than are probably necessary.
Yeah, like and then like regarding like the barriers thing, I remember like somebody had asked like a question I got the Meetup basically saying like asking about what happens if you need two letters to meet your like jurisdiction standards. So
Yeah.
yeah.
So in 2022, WPATH updated their standards of care. We got standards of care 8. And technically now, according to WPATH, you should only need one letter, whatever surgery you're seeking. That being said, the medical system changes really slowly. And it used to be that you needed 2 letters for anything below the waist. So a lot of surgeons and a lot of insurance companies are still operating under standards of care 7, unfortunately. But the nice thing is there are 3 of us at Center who are able to write letters. And so if people reach out needing 2 letters, they're not already seeing a clinician who can write them a letter, we can provide 2 letters. The other thing that we've started doing is we now have a training for clinicians on how to write these letters. They're really pretty easy to do, but if you've never done them before, there can be a lot of anxiety about doing it right. And ultimately, what we're trying to do is train as many clinicians in the Chicagoland area and beyond on how to write these letters so people don't have to come and see us if they already have a therapist that they're working with, so that their therapist can provide them with their letter rather than having to do an additional appointment.
Oh yeah, that's right. Like that's awesome. Like that's awesome that like we're getting like more people to be helping our community out and such. I like there was a discussion I also remember about there being a wait list. I basically like basically asked about like could you elaborate on that?
Yeah, luckily for us with letters, it's usually a very short wait. We can usually get people in within 2 weeks. Sometimes it takes a bit longer if people have more limited availability. But because there are 3 of us and we all write 1 to 2 letters a week, we can get people in pretty quickly, which isn't always the case other places, right? Everywhere tends to be pretty backed up. And while we often have a wait list or no availability for individual services, we do our best to always keep space open for people seeking letters so that there isn't a long wait between when you reach out and when you get to meet with someone to get your letter.
That's good. That's good. And then I remember like basically you had brought up basically a couple of like various books that you were liking. Like I remember you were talking about like a couple like I think one of them was like basically I forget the I forget like the oh my god I forgot the names but it's like it was like 4 letters it was like 4 words long and like the last word was bodies and it's like
Mhm.
basically an anthology about like people's experiences. The first one had to do with like yeah, the first one had to
Yeah.
do with like yeah, with and then the second one had to do with trans experiences. So
Yeah, I think the book you're referencing is called Trans Bodies Trans Selves, and it's modeled after the book Our Bodies Ourselves, which was one of the first like medicalized texts written about women by women. And so Trans Bodies Trans Selves is written by trans people for trans people, and it has just a plethora of information, everything from like medically transitioning, socially transitioning to navigating dating to everything else you could think of. So it's a really great starting point for anyone in the trans community who's looking for resources, but it's also a really good starting point for any cis person who wants to learn more about the trans community and be informed by people who have that lived experience.
Do you want to elaborate more about the training program that you mentioned for people who want to like that you was mentioning about like getting like providers more updated on like WPATH standards?
Yeah, so in order to provide a letter of support, you do have to have a full clinical license, so be an LCPC, an LCSW, or a licensed clinical psychologist. But for anybody who has those licensures or is on their way to getting those licensures, we offer this training. We're offering it 2 times a year. It's only 2 hours. People can get CEUs for it, but it's an opportunity to come and just learn more about the letter writing process, what's expected, what's in the WPATH standards, a little bit about the history. And then clinicians actually get to leave with a copy of our template. So we don't feel like we need to be precious about this. We want to support people in feeling like they can write good, strong letters that will support their clients. And so I go through it. I break down all of the nitty gritty steps, why we worded things the way we did, and give people that as a starting point. And then they can edit or change as they need so it matches their voice better. But really, the goal is to have just any clinician be able to do this, right? To not feel like you have to come somewhere like Center on Halsted in order to access these services. Part of this grew out of the fact that we had a number of clients coming in saying that they were in individual therapy, but their individual therapist didn't feel comfortable writing them a letter. And so if we can help more people be comfortable, that's what we want to do.
So that's great, lovely. Um, and then I remember there was a like the part about like the part about like the anyway, like I remember like basically somebody had asked about like basically like how do you get like a copy like paper or digital of like the support letters?
Yeah, so we have an electronic health record system. So if we meet with you virtually, we upload it into your record system. You can download it, give it to whoever is needed. If we meet with you in person, we still upload it into your electronic health record system, so you have it there. But you also leave with a paper copy in your hand. So all different ways. We're also able to work with clients if some surgeons have pretty strict rules about the letter needing to come directly from the letter writer. So we can always fax letters over if need be, or if we've done things before in the past where we've like mailed letters to people if they had difficulties with the electronic health record system. So really we try to be creative in making sure we get what you need to you in the format that works best.
Yay. And now now I think I remembered like another thing that came up, like basically somebody asked. It was about like how do you basically like what were some tips that like about like writing letters for insurance people?
Yeah, I think someone had asked because their provider was writing one, but it was their first time writing a letter. So some of the things that we encourage people to do, I mean, obviously go and look at the WPATH standards. It lays out pretty specifically what needs to be included in the letter. But some of the things that are really important, especially if someone has insurance and they're utilizing that for surgery, we want to make sure that we're documenting s- uh, persistent gender dysphoria. So meaning that someone has been experiencing gender dysphoria for a long time in their life, and that makes it medically necessary. For anything below the waist, we're often documenting things like how long they've been on HRT and if they feel informed about the impacts on fertility. Insurance companies often want to see a statement about having people that can support you post-surgery because the recovery process can be complex and you're often not able to move in the way that you normally can, and so you need some additional support there, that people are well informed about the impacts of surgery and ultimately that they can make an informed decision, right? So really what letters are documenting is that clients can provide informed consent. They understand what they're doing, they want to do it, they understand the risks and potential complications. And at the end of the day, that's what we're saying, right? People know themselves, they understand what they're signing up for, and they want to proceed with it anyway.
And I had a quick question. So once they get the letter of support, they bring this to their medical provider who's either going to be doing the top or bottom surgery. What's the next steps look like for the patient on their end? Does it take a period of months to obtain that surgery after receiving the letter of support? I know some folks who might be watching this might be curious. Okay, I have my letter. What's next? What do I need to do? Could you go a little more into detail about that?
Yeah, so different surgeons operate in different ways. So some surgeons will require that you have a letter in hand to even schedule an initial consult. Some don't. It varies quite a bit. And then as far as the time from an initial consult until getting your surgery scheduled, it'll also vary by the surgeon, right? For some surgery programs where they have a deeper roster of surgeons, your wait time might be shorter, a couple months. For some people, like Dr. Allison Shore is a really popular person to do chest vasculinizing surgeries in the Chicagoland area. She tends to have a wait list of like up to a year. So it varies quite a bit. Um, Something I would encourage people to do is when they're reaching out to surgeons is to ask, right? Do I need to have a letter for the initial consult? What's the normal wait time between an initial consult and getting surgery scheduled? What sort of things need to be in, what ducks need to be in a row? Generally speaking, most surgeons have a team that they work with who support clients through this process. So helping them navigate the insurance piece, making sure they have all of their letters, making sure they have everything that they need, making sure that insurance billing is going smoothly, all of that kind of stuff. So there's usually someone who can give you more information about like what it might look at that, like what it might look like at that particular surgery center.
Thank you so much for being here today, Ashley and Eve, for letting us know pretty much how we're able to get a letter of support for gender affirming surgery. We're going to go ahead and drop some links in the video description for the resource here in the Chicagoland area for Center on Halsted's Behavioral Health Department and how you could gain a letter of support through them. And for those who might be watching outside of Chicago or even the state of Illinois, there's going to be a couple different resources that we link as well that you could check out and see how you could obtain your letter of support. So thanks for watching. If you have any comments you want to make, go ahead and drop those in the comments section, and we'll see you in the next video. Take care. Bye.